vibes, but the time change this weekend might do it.
And it could make for a tough time for anyone suffering from seasonal affective disorder, otherwise known as SAD, or even worse. To find out how to help, we're checking in with psychologist Dr. Laura Saunders. Hi, Doc. How are you doing today?
Happy Thursday.
Happy Thursday.
Explain to us what SAD is for those of you who might not have heard of it.
Right.
So this is a real thing, right? It's a mood disorder characterized by depression that really occurs around the same time every year, usually the fall. It's more likely if you have a pre-existing condition like pre-existing or vulnerability to depression or anxiety. But it really has a lot to do with the amount of light and the amount of energy that we put out there. It has fatigue, low energy, hopelessness, sluggishness, agitation, social withdrawal, and it's usually self-diagnosable.
What does that mean to be self-diagnosable? You can just feel it, you know that it's coming, especially around this time of year when we flip the clocks back?
Yes, so, right. This weekend is daylight savings. It's estimated that about 6% of the population has some type of seasonal affective disorder, about 14% for mild symptoms. So you can start to feel yourself around this time. I mean, I've heard a couple of people say it yesterday. It's getting darker earlier. It's pretty cold out in the morning. You know, we're starting to see some frost in some places. I'm not going to be outside as much. Right. People start that kind of dialogue and self-talk around, I'm going to be stuck inside. I'm not going to have any energy. I'm going to be tired. Right. So they already start to see how it affects them.
Well, I mean, the change in daylight does affect when our body creates natural melatonin. Right. So that must have an effect.
Absolutely. It really has to do, I mean, it's vitamin D, right? And so there's things that we can do to really help ourselves. Number one, it's always identifying what's going on. I was okay a month ago, but I feel like my energy's less now. So maybe I'm being negatively affected by, you know, the change in seasons and less light out. So what do I need to do? I need to get outside during the day. I need to get some vitamin D exposure. I need to get regular physical activity. Even a walk can be really helpful.
All right. Now, for those of us who can't get outside, there are like light boxes or things like that we could use.
Right.
Are they helpful?
Put them right at your desk or in your house?
Yes, they can be very helpful. People have them at work, sometimes in their house. There's a lot of different ones out there, so you have, check with some reliable sources. But you sit in front of a bright light box every day for about 30 to 45 minutes. It can be usually first thing in the morning or in the afternoon, and it just brings some light into your brain, right? And so it just energizes you in such a way to help offset some of the sluggishness or low energy or even agitation from seasonal affective disorder.
Now, we're not talking tanning beds here. We're talking light boxes.
Right. Different levels.
Those are for different things. Yeah. But yes, these are light boxes. They're not meant to tan you, but it is meant to give you kind of light energy, right? Ultraviolet energy to stimulate your mind and your body. I mean, there's other things that we can do. We can try to socialize a little bit more. We can really deal with some of the whatever the symptoms are. So if we have fatigue, we try to get a little bit more sleep, try to go to bed a little bit earlier, try to eat a little more healthier, right? There's things that we can do to help ourselves, but it really starts with identifying what's going on. And there's, many of us that have a touch of it. So it's really, it's a real thing.
Now, speaking of socializing more, I tend to kind of shut down a little bit on the weekends, but Caitlin's making me take her out to lunch tomorrow. Is that a good idea?
I think that's an excellent idea, and I think you should treat.
Thank you, Dr. Saunders.
That's advice from an expert, too.
You have to listen to the expert.
Thank you, doctor. We appreciate your time today.
Thanks, doctor.
And thanks. I'm sending you the bill.
No, he's picking it up. You should come.
Take care. Hey, Scott, I loved your Mercy piece. It was beautiful.
Oh, thank you. Your daughter went to Mercy, a graduate, right?
Absolutely love Mercy High School.
All right, I do too. It's a terrific place. Thank you, Dr. Laura Saunders, psychologist at the Institute of Living. Good to see you.